It's 1:40. Welcome, students. It's session 3 of the Health Sciences segment and breakout session. I'm here with a series of panelists. We have bonus. Most of our panels have 3, but we crammed 2 heads into one box, so we actually have 4 panelists for your session right now. We have Jenny Nguyen and Karen Clements, Reed Cooter, and Emma Kelledy, and I will let them introduce themselves in that order right now.
In that order. So I'm Jenny. I'm Dr. Clements' treatment coordinator, and I guess practice manager as well. I've been with her for almost 2 years, 2 years on Valentine's Day. And I started out having gone to dental assisting school, and I began in the front desk.
And I'm Dr. Clements, and I'm an orthodontist in Kirkland, and I've been practicing for about 20 years.
I'm Reed Cooter. I'm the owner and clinic director of Phoenix Physical Therapy and Personal Wellness here in Issaquah. I've been a physical therapist here in the community for 22 years.
And I'm Emma Kelledy. I am a recruiter at Overlake Medical Center and Clinics. I've been in healthcare recruiting for about 2.5 years and been at Overlake specifically for the last 8 months. I recruit primarily for inpatient hospital for clinical roles, specializing in registered nurses and certified nurses.
Awesome. Thank you so much for all being here. Thank you, students, for being engaging. I love it. I already have cute little chats and like people greeting saying, nice to see you, panelists, from the students. So thank you for being here. Students, on the Accelements page, this is your 3rd session, so you probably figured it out by now, but feel free to drop things into the chat. Or if you have questions, feel free to drop them into the Q&A. We do have some material that we're going to go through to try to cover to give you a broader scope of available opportunity within these pathways. But if you have specific questions, by all means, we encourage you to drop them into the Q&A and we'll get to them. So I guess maybe what I should start with, and there's always an order thing. Maybe I'll just stick with the same order of Clements Orthodontics, then Phoenix, then Overlake, is maybe if you could just each speak briefly about what your experiences in having careers without with a non-4-year pathway within your industry or office, what you've seen and what your experience has been.
We have opportunities in the dental field in general. People can go to a dental assisting school, which is what Jenny did, but actually Jenny went into the clinical position first because that's what we happened to have an opening for. And then she was thinking of going into to the clinical setting. She was a rock star at the front desk, and she's kind of stayed in more in an admin role. But there are opportunities to go to dental assisting school. And then becoming a dental assistant, or doing just, if you're interested in orthodontics, sometimes you can just go straight into an orthodontic office and learn from the orthodontist, start in sterilization and learn there. And also starting in the administrative roles, you can start from scratch, or you can starting as a scheduling coordinator and moving on up from there.
Great. Lots of opportunity in orthodontics. Reed, welcome back.
Thank you. I'm sorry.
It's okay. That's how the kids know we're keeping it real. It's live. You know, we drop out just like there's Zoom classrooms. At least we're not just black boxes with names, because that's what they look at most of the time. Reed, how about in PT?
Probably our first and foremost position under a 4-year degree would be the PT assistant position, which.
Oh no, we lost him. Okay, Emma, I'm going to have you take, oh wait. Okay, PT assistant position.
Yes, so they are assistant to the PT by definition. They can carry out a treatment plan that's been designed by their primary physical therapist. They can do all of the same functions as a PT, including manual therapy, therapeutic exercise, modality delivery, with the exception of being able to diagnose or assess a patient or change a plan.
Okay, awesome. Emma, I'll let you take it over.
with the hospital, there's so many opportunities for non-four-year degree positions, both on the clinical and on the administrative side. On the clinical end, one of our most popular ones are CNAs, or we call them patient care techs at Overlake. They help the nurses, activities of daily living, or they're just such a backbone to everything at our hospital. We also offer still on the clinical ed, medical assistance is a huge one as well. Surgery assistants, just so many different positions. And then on the admin side, we have scheduling coordinators, patient access coordinators, security, just a lot of different opportunities.
Okay, Namit, I hope I pronounced your name correctly. You asked a good question. What is a PT? I'm sorry, I just abbreviated. I'll let you answer that.
PT is a physical therapist, so we specialize in movement assessment, strength assessment, function assessment to regain the ability of patients from injury, surgeries, overuse consequences, those sorts of things.
Excellent. One of the questions that I feel like the kids always want to know as we kind of start thinking about the breadth, right, that is on the screen. We have dental, orthodontics, we have physical therapy, and then we have Emma, who represents literally hundreds and hundreds of different careers within a medical system. And so I always like asking Karen, Jenny, Reed, what drew you to the position that you're currently in? What is it? What are your highlights? What makes you love your job? What makes you love coming to your job? And maybe what are the things that you find really challenging about that same job that you love so much?
I'll start, give a little different answer. What drew me, and I actually had a friend who was a dentist, and what drew me originally was that she told me that it's a mixture between science and art. So that is something that can, if anyone is thinking about dentistry in general, it is a little bit craftsy, and it's also healthcare. But also patient care. So it's, working with people. So I think that's what drew me to it. I don't know.
What drew me was actually I was just looking for a job. And I had a friend who was a dental assistant, so she referred me to a program, and I went in blind, knowing nothing about it, and then I ended up liking the patient care side of it quite a bit.
How did you choose? Karen mentioned that you you started down a clinical path and then ended up really embracing and loving the administrative path. How did you decide to make that change, that shift?
I think I found that it made more sense for me to be in the front office. A lot came more naturally. My aptitude was there, and so it was more of just a better fit for my personality rather than what I wanted.
It's wonderful. Reed, how about you? And then there's also a sub, Misha, I see your question about how do you become a physical therapist? And so I don't know if maybe you want to cover how you arrived at it and then the path that you took personally to become a PT.
Sure. I was an athlete in high school and in college, and I wanted to stay within that athletic world. So physical therapy was a profession in which I could still work with athletes in a way to rehabilitate them to get back to playing sports. So it was certainly enticing that way. And once you start looking at the field, you can work anywhere. If you want to work with dancers in New York City, you can do that. If you want to work with kids in Wyoming, you can do that. If you want to work with high-level quality folks in Issaquah, you can do that. So I think that just the expansiveness and the opportunity in the profession really kind of enticed me. And so I went to undergrad college back in Michigan. I took the route of biopsychology as my undergrad because I also realized that I wasn't just going to be working with things, I was working with people. And so to be able to have that psychological background in terms of motivators and triggers and being able to be empathetic with people when they're in a position of loss, all of that really functions on a day-to-day basis for me as far as, motivating people to get better, recognizing that there is a loss that they're dealing with on a day-to-day basis. So you do have to become a physical therapist, it is a 7-year collegiate career. So you do a 4-year undergraduate degree, and now it's a 3-year doctorate program. So there is a long time frame there. And again, that's where we have that PT assistant that does function very similarly, a little less paperwork, a little less evaluations, but is able to do that hands-on and really integrated healthcare as well. So
Excellent. I want to come back to that pathway later in the discussion. I love how Karen and Reed, you both mentioned so much about your story of how you arrived to the professions that you arrived to had to do with things about your personality. Jenny, you shared that as well, about just being a good match. So I guess one of the questions I'd love to ask is, within each of your industries, and Emma as a recruiter, who gets boatloads of resumes and sorts through these and whatnot, and when you're interviewing people, either live or on Zoom, what are some of the soft skills and traits that you are looking for that you would encourage students to have as they pursue a career in healthcare? And I'll probably start with Emma on this one.
Yeah, I mean, the end goal is the patient experience. So we really want people to recognize that and have that compassion and have that passion for the healthcare field. I think is huge. So just being able to portray that when you are talking to a recruiter, you are talking to a nurse manager in your interview. And then I think, you know, on the other end too, teamwork is huge. You're working with tons of people throughout the day to get your patient care. Flexibility, things are always changing in the healthcare field, so being able to just roll with the punches, being able to be calm. It can be a stressful and sometimes exciting environment, but stressful for sure. So having that ability to be calm too.
Excellent. Karen or Reed? Are there any specific soft skills that you think are super important, you know, within healthcare as in the greater scope, or within your industry specifically?
So I think that for in orthodontics, I think problem solving skills is a big one, because we're always, you know, coming up, we're like putting the puzzle together, and a lot of times it's, you know, there's a lot of independence in what our assistants are doing, and even at the front desk there's a lot of just problem solving and making everything work together, and teamwork. Again, I think that's probably big in any job, and any job that you're doing, you're and independent. I mean, you need to do both. You need to be working together as a team, but also getting your part done. So independent working too.
Yeah, to build off that, time management, just basic time management skills, I think in healthcare, especially in fast-paced healthcare environments, having an idea of when you need to be finished and prioritizing your tasks as well, and it can really come in handy.
Excellent. Excellent. Reed?
So plus one to all of that. I would also add that, you know, patients are unique. So you can have 5 patients come in with the same diagnosis, and all 5 are going to present differently. So there's creativity, and then there's divergent thinking, which is many more ways to use a service or a tool. So you have to be able to adapt to what the patient is presenting with.
Oh, he froze. Welcome back.
Adapt. You have to adapt.
We have to adapt. We have to adapt.
Yeah, but just.
Oh no! I think it must be his connection in that building. I'm going to put out another question here, that just popped up in the feed, and it's relevant. All right, so we're adapting, Reed.
Thank you.
We're adapting. Are you choosing to make your responses really brief now so they can fit within the drops?
Super fast in the window of my webpage allowing.
Okay, well, this is a question that just rolled in from a student, and they shared that they actually have a math learning disability called dyscalculia, which makes math a lot more difficult for them. And so they have some apprehension about whether or not they'd be able to work in the medical field. And if that would be like a limiting factor as they go through their education. So I am going to open that up to anybody who has either personal experience with that or hiring experience, if you think that would be a limiting thing for the student.
I think I'll say for the dental assisting, or at least for orthodontic assisting, I don't think there's a lot of math involved there. If you're doing financial coordinator, that wouldn't be a good fit. We need to be very math oriented if we're looking at the numbers and sending out, you know, figuring out insurance benefits and contracts. But for dental assisting, there's not that much.
not in the program either. There's some basic math courses you'll need to take, but it's not the primary focus of dental assisting school or most dental assisting programs.
Emma, how about with all the different tech positions in the hospital? You have your rad techs, your ultrasound techs, your, I don't know, fill in the blank tech. There are like so many tech positions. Like from an outside perspective, those sound very hands-on. They sound interesting and varied and whatnot. Do you have any thoughts about this particular learning disability and if that would impede the student to pursue any careers in that area?
Yeah, I don't think it would at all. I mean, skills can all be taught, and that's kind of how we focus. Skills can all be taught. We're really looking for the personality and, you know, the teamwork and the compassion, all of that, and everything else can be taught. And it is really hands-on. So I think your ability to, you know, communicate with the patient and have that true patient care is so much more important, and everything else can be learned.
Awesome. That is super, super helpful. Let's see here. You know what I'd love to hear, and I think, so this is our third session, and so we've had the opportunity to go through this a couple times. I've seen the questions from the students in all the sessions, and something that never gets old for me to hear are these growth opportunities that all of you have stories about how you've witnessed or you've hired or you've placed professionals, individuals in one position and literally watch them grow into other positions and expand their career. So I'm wondering if you could take a moment to share some of your experience on all of those. Reed's back for now, so I'm going to start with him.
Can you repeat the question again? Sorry.
Just in terms of what you've seen in terms of growth advancement, if you've ever had somebody come through or growth opportunity, like when you talked about PT assisting, oh, I can't tell, is he frozen? Oh, he's frozen. Wow, this is a signal thing. Emma, can you tell me a little bit more about Overlake? I think Overlake has some really, really unique opportunities because they're a larger organization. Can you tell us a little bit about what that looks like there?
Yeah, I think Overlake is a really unique hospital because of our size. You know, we're large enough to have all of the different units, and you can go and gain experience in whatever different fields you want. But we're small enough where you can have a voice to say you want to go do those things. So, you know, for us, we really want to grow people within Overlake. So if you come in as a patient care technician, you can go right into one of our RN residency programs, and then into a staff nurse, and then on to become a nurse manager. We've had people go all throughout in that realm. Similar with our medical assistants, if you're coming in on the admin side, say for example, if you're a patient scheduling coordinator and you want to become a medical assistant, we have a medical assistant apprenticeship program that you can do, and we actually pay for the program, and then that leads you directly into a guaranteed job as a medical assistant, and then you can go up to a medical assistant too from there. So just tons of different avenues to grow within Overlake.
Now, you mentioned this apprenticeship program. I think that's something that's so special to have out there. I think there are so many opportunities for people to, it's almost like a try before you buy, right? Type of situation to learn in a unique clinical situation, setting to be able to see all of that. How long does like an apprenticeship program like that last or take?
I don't do MAs directly, so I'm not sure. I think it's about a year or two, but don't quote me on that. With our residency programs, for example, our RNs, you can do a residency with an ADN or a BSN. So a 2-year program is an ADN and the 4-year program is BSN. There are accelerated BSN programs. Our residencies are a 3-month period where you're a resident, and then you go into a staff RN, but you're constantly learning, and you always have that support.
Awesome. Can you also talk a little bit more about the tuition reimbursement programs and what the, for students who are logging on and maybe have never even heard what a tuition reimbursement program is, can you explain from like an HR perspective what that is, what type of organizations tend to offer it, and then how Overlakes is structured?
Sure. So tuition reimbursement is where the employer pays for you to go back and get continuing education. And so that's huge for Overlake because we want people to grow and we want them to grow at Overlake. So if you, again, if you're going back to nursing school and you're currently a CNA, we actually will pay for that, help you pay for that. We currently do $5,000 a year. We do want to increase that, but currently $5,000 a year. And then that comes with just a payback program, not with money, but with your time. So if you go into a residency program, then and you just continue working, then we pay for that.
It's wonderful. That's great. Karen, in your profession, I feel like there are so many different pathways and opportunities. It was so encouraging to hear you at the beginning say, wow, the majority of my staff and my team members have positions that don't require a 4-year degree. I thought that was super, super encouraging to hear. Can you tell me something about, and Jenny, I don't know if you have any personal experience from your pathways that you want to share about just what that looks like, growth and change and opportunity, and kind of how your career can continue to evolve.
Well, I think I'd love Jenny to share her story. Okay. So yeah, I started here as in the front desk scheduling coordinator, and over time there have been some changes in our office beyond the remodel, some staffing changes, and in that time I developed a lot of experience in the front office as far as, first of all, my orthodontic my knowledge of orthodontics, but then about the office culture and the system that we use that's specific to orthodontics. And I advanced pretty quickly, I would say. Right place, right time was part of it. We had a couple of staff move on, but because I had been in the front office and learning the entire time, I developed the skills necessary to fill the roles that were vacated with staff retiring and whatnot. It just worked out.
Yeah, so she's become, she started out as kind of like the entry level from scheduling coordinator, and now she has become the treatment coordinator / office manager. So she's kind of come all the way in about 2 years, because she's a very hard worker. She's tech savvy. She's she's learned, fast learner. Yeah, so she's
that's amazing. That is an amazing story. That's wonderful. Reed, you're back. PT assistants, when you've spoken about, hi.
Hi.
It's okay. It keeps the session lively. PT assistants. Can you tell us a little bit about what you know about that pathway, and you've talked about getting your foot in the door versus the 7-year college bound and graduate degree pathway.
Yeah, the PT assistant program is usually around 2 years, or about 6 quarters, and you get your applied
feel like we're hanging on every last word.
You get your applied associate of science degree. And then you can go into the field right after that. There are clinicals that are part of the curriculum. That's where you have the academic portion of your training, and then some clinicals. And then you're ready, after you pass your national exam, to be licensed as a PT assistant, to go into the clinic and start treating. And there are bridge programs to take you from that associate degree to a PT degree without having to do a lot of the 4-year undergraduate degree. They take into account your experience and your already completed curriculum, and put you into an accelerated program to get your PT degree after that.
I think that's a really amazing point to highlight to some students watching right now. I think that students choose to not go a 4-year path for a variety of reasons. And sometimes one of the reasons that we've heard in the past is financial, that they could, they would, they have the opportunity, but they just can't make it work because of the situation that they're in. And so what's really attractive about that is it's worthy of note that in a situation like that, students can take a program, start working sooner, and then have their professional experience as well as their previous education acknowledged and recognized in lieu of what would have been paid credits in some scenarios for some programs. And I think that that's just a really, really special thing, a really neat opportunity. Excellent, excellent. Okay, Namit has asked a question. He's saying, are there any technology positions in the medical field? Now, Namit, I'm not quite sure. Well, everything feels techie now, right? And so I don't know if, Namit, you want to, do you mean information technology, or I'll let him clarify if he wants. But Emma, I don't know if you want to take that in terms of technology and like tech savviness in these positions that you place. Like, what do you see? Is there a trend there, or is there more of an opportunity?
Yeah, I mean, technology is huge in healthcare, and I think it's only going to get bigger. So, you know, we have our whole, if you're talking about IT positions in general, we have a whole IT team. We have, you know, our Epic team, which is our electronic healthcare records. We have a whole team that just focuses on that. So there's tons of different aspects of healthcare that's not just clinical. If you're not wanting to really be hands-on, but you're still wanting to work in healthcare and be able to give back to the community in that way, I think a technology position is great for that. You know, we have, this is actually entry level. We have materials technicians who are the ones that, you know, do all the stocking and ordering and all of that. So there's just so many different avenues.
You nailed it. Namit said more towards information technology. So I think we just answered that. I think there's lots of opportunity for you in that area. I love how engaged this group of kids is. And I wanted to just kind of round out with an opportunity for you guys to do two things. Maybe briefly talk about what inspires you each day, why you love what you do, and if you were talking to a younger version of yourself in high school, what you might encourage these high school students to take as next step. If they are feeling, if they're on this session and they're thinking, wow, I didn't think about that, I want to find out a little bit more about X, Y, or Z. Do you have any recommendations on what you might recommend to them?
Doctor's gonna go.
Karen has to go see a patient.
Me.
Jenny, I'll start with you.
Okay, what do I tell my high school self? I think it's a little hard when non-traditional routes are stigmatized, and I really appreciate that you're doing this panel session here, providing this information, because I, for the same reasons as you had pitched, for financial reasons, didn't want to go the 4-year route. Well, I ended up pursuing that anyway. I'm in school right now and pursuing my 4-year degree. I've always been in school full-time alongside working here, and that's something I would tell my high school self, is that it doesn't have to be one or the other. If you work really hard and are passionate about what you're doing, then you can do both. It's obviously going to require some sacrifices, right, in your personal life, but of course, we're talking about the future, right? So to set yourself up for a successful one, it'll require hard work and sacrifice.
I love that. I love that. I think that that's such a good, important message to send. How about you, Emma?
My high school stuff, I'd probably say, you know, follow your passions and have the confidence to follow your passions. You know, I think the math question about not being great at math, don't let that stop you. If you want to go into healthcare, you know, your passion will take you there. So I think that's a big piece, is just having trust in yourself that you can do it.
I love it. Reed?
As far as what fuels me, I'm fueled by patient gratitude and that the way that impacts my day. And I think looking back, I think, and I'm going to kind of tie in Namit's question, it doesn't have to be just a profession that you see. I think if you have a passion for healthcare and helping people, but you also have a passion for robotics, you can bring those two things together. And I think the professions are only as limited as our imagination, right? And we see the way that technology comes into play with robotic assisted surgeries. And I think there's a really big place for those sorts of creative designs to fit into healthcare, even the way that we treat patients. You know, we have so many different things at our disposal now with technology that to implement and fold that into what we do on a day-to-day basis, I think is certainly an opportunity out there. So don't limit yourself to a definition of a profession.
I love that. I love that. Those are all such good. Where were you guys when I was in high school? That's all really good advice.
Also in high school, yeah.
Also in high school, yes. Yeah. That's true. That's true. And then I guess one last thing, we have 2 minutes left in this session. I don't know, kids, if any of the students have last minute questions, this would be the time to drop them into the Q&A. But next steps, I always think that there's a great opportunity for next steps on like what's accessible. It's hard with COVID right now. So for kids who are kind of feeling stuck, they're stuck in the home, they can't even go to school. If they are excited and impassioned, they want to get a jump on them, how do they learn more? Do you have any recommendations of things that they can do? Reed, you still have service. I'm going to ask you.
Yeah, that's a good idea. I think there are some opportunities to do some job shadowing and some exploration in that way. Definitely you can do things online, but if you can get yourself into a facility, we like to take job shadow students in here, again, somewhat limited with COVID based on wanting to keep a minimum level of people in the office. But, if there is opportunity to be able to do that, there's no other better way than to see it in action and to experience what it feels like to be a part of that sort of environment. So looking at different ways to put yourself in the positions to explore the professions in, one-on-one would be a great idea.
Wonderful. Emma, do you have any recommendations in terms of resume building and things like that they can do right now?
Yeah, I would say first start off and just start talking to people. I think I said this in our other session, but if you have someone in your family who is a nurse or who is a doctor, just start talking to them about what a day in the life looks like. I think that'll give you a lot of exposure to what might be a good fit. And then for resume building, there's great templates out there. I would just say have someone look over your resume every time before you submit it, just to catch the little grammatical errors. And I think for when you do start interviewing at places, just take a look at their website, make sure you know the company a little bit. And familiarize yourself with their values and all of that, and just be passionate and share excitement in the interview always comes across huge.
Awesome. Jenny, any last recommendations in terms of things that you would recommend kids do?
Well, I agree with both Reed and Emma, and I would say just networking, building connections with people in the industry, even if it's kind of a cold call situation, as long as you're reaching out to places that you're interested in and just putting your name out there. A lot of offices are more open than you think they are and willing to have someone come in, even at a high school age, to just, as Reed said, job shadow. We hire sterile techs out of high school, even while they're in high school. And so you can develop that experience even just over the summertime and have that connection there. One of my coworkers, she started working here in high school and now she works here. And she's been here.
Oh, that's wonderful. Well, you're getting a bunch of thank yous in the chat from people. So thank you so much for your time, panelists. Thank you, students, for taking your time. I guess this concludes our time. I think students, you have a closing session that you go back to, and panelists. I'm going to stop the broadcast, but want to thank you so much for your time.